do. It's called Conversation with the CEO. I'm so excited for another edition of Conversation with the CEO. What's so cool about today is I'm excited more about what we all are going to learn, right? I don't know about you, but sometimes you get confused with things. You get involved with something and then you think you knew it, but you really don't. And you go back, oh my God, if I would have just really talked with a mentor, I would have learned something and I would have been able to benefit from it. But a lot of times that ego gets the best of us, right? We want to prove that we can do it without help. Don't be that person. Don't be the person who tries to do it without help. That's one of the reasons why Linchpin Bunch Inc. does what we do, okay? Conversation with the CEO, because if I was the smartest person in the room, what good am I? Okay, I do these interviews because I'm talking to someone a lot smarter than me so we can all learn. Our guest today, let me just say this. He is gifted at critical thinking. He's forward thinking. He's very good at risk management. Was an operations manager for a couple of universities. I'll let him talk about those, but just know he's got a lot of credibility here, okay? One of the things I like is he's a real talker. He's straight. And y'all know me. I'm going to tell y'all like it is. When he decided to be on this particular program, Conversation with the CEO, he didn't want anything. It wasn't about what could he get out of it. He just wanted to give out information. You know I love people like that, right? I love people who want to help people because that's what we're about. Our whole team, that's what we do. We're here to help, and that's why we're going to do it today. Our guest today, his name is Gregory Hodge. He is the managing director for Hemingway, Hodge & Associate. Ladies and gentlemen, let's welcome him to the program. How you doing?
Very good. Thank you for this opportunity.
Oh, man.
Very much appreciated.
I'm so excited. So let's get to what we're talking.
Yeah.
You're a businessman. You're well-traveled. You've been all around the world. You're good at what you're good at, right? I mean, you really are. So I know we're going to learn something here, but we're going to specifically talk about something that we all think we know, but we don't really know.
And it changes every day, every hour, every president.
It's called healthcare insurance.
Exactly.
Now, you're going to help us get a lot of the mixed information out of the way, okay?
Yeah.
So I'm going to start with a great question.
Mm-hmm.
Healthcare. What do most people think it is versus what it actually is?
That's a really good question. Because people think healthcare is you get hurt, sick, you go to the hospital, your bills are going to be taken care of. You know, oh, what do you mean I have an out-of-pocket expense? What do you mean I have a deductible? They don't think of that when they're going in. The healthcare system in America was set up for critical illness only.
Okay.
It wasn't set up for the stomach ache, the little cut on the wrist, all those things. Okay. That's not what the American healthcare system is set up today as now. Now, in the past, when I was a kid, and I'll date myself, back in the 60s, I was highly accident prone.
Okay, gotcha.
Okay, I got hit by 7 cars. I fell from trees. I played football. My mom could take me to Children's Hospital. There's no deductible, blah, 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 blah.
Yeah, you needed help.
I needed health care. Yeah, because I would have probably been dead in today's system.
Okay.
But today it changed.
Okay.
It changed probably in the last 20 years when people started paying more for health care at work, where employers were like, well, I got to cut my staff because I can't afford the rise in healthcare cost.
Yeah.
Because of the transition of the older people getting older. People don't take this into consideration. They're like, oh, I'll just get healthcare. And why is my cost going up? Well, you got to remember, there are people before you.
Okay.
And you got to take care of them because they're not making the same income they made when they were 40. They're retired. And if they didn't have a pension, which most people don't, or put into social, which most people didn't, their retirement plan is strictly Social Security.
Okay.
So you try to go to the hospital, right?
Yeah.
And you're making this much. You got rent, food, then medicines. You know, of course, healthcare costs are going to rise because got to take care of the people that were here before us. That's the whole concept of society.
Now, I always hear this statement. I've heard this statement more than I can imagine. It's like, I got to choose medicine over food in the refrigerator, or keeping the lights on. Tell me, where did that really come from? Because, my understanding, medicine didn't seem to be that much. You got companies like GoodRx and stuff like that.
Right.
I mean, help me out on that because a lot of people complain about that.
The problem is, and it has absolutely nothing to do with healthcare. If you look at the biggest corporations in the world, they're medicine corporations. Bayer, Merck. Just look at the panel that was in front of the Senate in 2000. I think it was 18 or 19.
Okay, yeah.
The Big Five.
Okay.
They make billions.
Okay.
Billions. Even the vaccine that came out, billions. Even though it didn't cost us, they still made billions. The problem with healthcare and medical is that the typical aspirin doesn't cost $10 anymore.
Okay.
It costs $2.
Okay. Okay.
But you're used to paying 10.
All right.
So if you're used to paying 10 and then I lower it to 2, you're going to be like, well, what the hell was I paying the last time for?
Okay.
Right? So
you start questioning the system and then that becomes a bigger issue.
Way bigger issue. And way outside of my topic on that.
Okay. All right. Let's get focused then. I got another question for you. You know, like you mentioned earlier, the job may offer health care, but is there a much better option than what the job offers, or is it better to go with what the job offers you?
Well, here's the real thing. What people need to do is stop looking at healthcare as, I'm sick, I need a plan, I need it to fix this and that. What they need to do is like they do in anything else. You need to take an inventory of your health. And people go, what the hell is that? Well, it's simple. Talk to your parents. Do you have diabetes in your family? Do you have, heart disease in your family? Have you been, and people don't know, have you been accident prone? Was your great uncle accident prone and then you became, everything is hereditary.
Does cancer run in your family?
Exactly.
Those kinds of things.
Exactly. And what you want to do is go take your annual physicals, get your medical report. And the big problem that a lot of people, I say that, and then people go, well, how do I do that? Well, the problem is probably 85% of Americans don't have a primary care doctor.
Okay. Wow. So, and I would assume the reason is because they can't afford it.
The reason is they haven't researched it and they look at healthcare as an off the side thing instead of having a primary care, because you can have a primary care in either one. So, you have healthcare, the regular guy that can go out and pay it and has an $18,000 deductible, whatever. Okay. Right? He has a primary care doctor.
Okay.
Okay. Then you have the ACA people that sit there and go, well, I'm getting subsidized. I can't. No, you are entitled to a primary care doctor. You just got to find one that takes the ACA program that you pick. And most of the programs are like Florida Blue, Humana, all those people actually have plans.
Okay.
So the first thing you need to do is find a primary care doctor.
All right, let me ask you this. Let's talk about finding a primary care doctor. So how do you find one? So, I'm working a job. I barely can make my bills, but I'm okay, right? I got a little bit to take the kids out to eat something on the weekends, but I don't have a primary doctor. Where do I start and how do I afford this without it messing up my financial situation?
Okay, so the key is you want to find one that's close to where you live. Okay. It's really not complicated. Google.
Okay.
And then you go in and you just don't say, well, I'm looking for a primary care doctor, and let the doctor control the conversation.
Okay.
Understand, this is your money. Okay. I don't care if it's $1. It's still your dollar.
Okay. So even if I got $1, I got the right to go into the doctor and say, this is what I want.
What you go into the doctor and say, what do you provide? Because this is my plan. Okay. He might say, well, I don't. Go, thank you very much. Get up and go to the next one.
Okay. How do I know I have a plan? So help me get clear this
up.
So
here's how you should do. So once you do your health inventory, so let's say you're married, 2 kids, right? Most people are like, the wife, guarantee you, there are very few women that change their gynecologists.
Okay.
Their gynecologist is the center of their medical world.
Okay.
So if their gynecologist refers Joe as the primary care, they're going to take Joe because they trust this person.
Okay.
Okay.
All right.
So most women have a primary care doctor.
Okay.
Okay. Gotcha. Or a doctor that they go to consistently That might not be on record, but is their primary care.
Okay, gotcha.
What happens is men sit there and go, oh, I'm fine, I'll go to who's near.
Yeah.
You need to have a consistent doctor because think of it like this. You take your car to the same mechanic because you trust him.
Right.
Why would you switch healthcare doctors when it comes to your body and your life?
Okay, gotcha.
You see what I'm saying?
But people do that, though.
Every day. And then they wonder why, if something serious happens, that, well, this doctor said this doctor said that, oh, my reports didn't come in, or you get reports from 5 different primaries. You want the one for the consistency.
Okay.
So you go in and cough, right? One doctor will say, well, he has bronchitis.
Okay.
Another doctor says, no, he just has a cough.
Okay.
You see what I'm saying? That's why you want that, build up that consistency. And once you have that and you have a primary care, then when you look at selecting a healthcare plan or changing one, you can go to him and say, hey, this is what I currently have.
Okay.
This is where I'm thinking about going. How would this affect our relationship?
Okay.
People got to learn to own their healthcare. I have many people that call me and go, Greg, what plan should I buy? I don't know.
Now, I want to bring up something because I interviewed a guy not too long ago, and that's it. We were talking about lawyers. It's the same way with lawyers. Mm-hmm. Some lawyers don't know expertise in certain areas,
right? So
they won't give you the right information.
Right.
Sometimes you need to get a specialized lawyer who can deal with something. They were talking about trust.
Right.
The way you're explaining it, that's what it's coming off to be. You got to find someone who, when you're talking to them, they understand what you're trying to accomplish.
Exactly.
Right? Are you saying that everybody can afford a doctor and it shouldn't break the bank?
Absolutely. Because even so there are 4, like I was saying. So you have the regular health care, mm-hmm. You have the Affordable Care Act health care, you have what they call half Medicaid. Medicaid. Yes, I got it right. I keep confusing those with the 65. Medicaid, and then you have full Medicaid.
Okay.
So each one of those, you can find a primary care doctor.
Okay.
Because each one of those, they accept that plan. Okay?
Okay.
So on the person that can afford the $18,000, right? They sit there and go, oh my God, I got a deductible of 18. There are plans out there that will take away that $18,000 chunk and bring it down to like $250.
Okay.
Per family member instead of $5,000 per family member.
Okay.
So you save right there. The ACA plan, depending on what subsidy level you got, allows you to get full coverage with doctor visits, and you still can pick a primary care doctor. You just find one that knows that plan. Because you might change it next year. Okay. Just depends.
All right. So say I'm uninsured, right? Say I'm uninsured. I'm
right.
watching this. I'm listening to this, and I'm thinking to myself, this sounds good to me, but I've always been uninsured, and I'm too scared to get because I just don't want to get in a situation I can't afford. I got a decent job, but I'm still uninsured. Right. So talk to that person.
So I would say, what do you got? What are you looking to cover? Because you've been uninsured for a reason. Most people are uninsured. Not always just because of money. Some people are uninsured because they didn't file taxes or they can't afford to get private insurance, which doesn't ask for those types of things. So once you leave the private world, you're in the government world.
Okay.
There's no in between.
So you got to have your stuff right.
You got to have your stuff right.
All right.
The government's not going to sit there.
Taxes got to be paid. Got to be caught up on that.
Yes.
Can't have no issues with the federal.
No issues with the federal.
You can't owe the federal no money.
Well, you might be able to. You might can still be in the thing. You just got to have them filed.
Okay. Gotcha.
Or in the process.
Okay.
And because what they do is the government says, yeah, we'll give you this, but understand once you end of the year, we're going to look for your tax return, and you got to support that subsidy. Because if you don't, now you're in a world of hurt because you got to refund that subsidy plus penalty.
See, you putting the light on this for me because now it's making sense to me. So,
right,
the issue with healthcare, first of all, is misunderstanding. They don't know what it actually is.
Right,
and then the other thing is people, even if they don't have the money, they didn't put themselves in a position so that they could actually use what's out there.
Right. Yeah.
Okay. How can we fix that then? So I messed up. Okay, I want to be able to afford some health care. Walk me through that process. Get me there.
So the way you would first do it is, I'm not a tax person, but you want to make sure your tax situation is correct.
Okay.
Unless you're going to do it privately, which will cost you a fortune. But right now, the ACA plan, which everybody boo-hoos and all that, and there are different people that say one thing and something, and I really don't care.
Yeah.
The bottom line to this dilemma is, if you don't get people healthy, you won't have an economy.
Gotcha.
End of discussion. I mean, you can take away the buildings, the houses, the cars, and all that. People are still going to be here. We're no different than the animals. I mean, I want to equate it to the show I saw on PBS, that this cougar had like four cats.
Okay.
All right. And she taught the four cats what to eat, what not to eat. Right.
Okay.
She taught them where they need to be, where they don't need to be. Right. But guess what? One of the cats ate something that was wrong.
Mm.
And now in cat world, you die.
Yeah.
Mom goes, whoop, one down, three more to take care of. Let's move on.
Yeah. Because they don't have
They don't have health care.
They don't have health care.
They don't have health
So
care.
they're done.
They're done. And that's what people need to understand. We don't have that option. You have private, which most people probably can't afford, but the ACA plan is by far the best option for a lot of people today that aren't on Medicaid, because it gives you a subsidy. And the beauty is, you have to make over $72,000 a year not to be eligible. And that's what people don't understand. People are like, oh, well,
what's keeping people from getting this education? Like, I'm
money.
Okay. I got you. I'm gonna say no more.
Strictly money, and it's heartbreaking, and it's kind of like, we got to get them, because there's a deadline.
So let's talk about you for a minute. I want to talk about you.
Oh,
I really appreciate what you're doing here today. People need to know this. What happened to you that made you care so much about this particular thing that, a lot of people I'm running into, they just totally don't get this healthcare thing, and they're missing out. They wouldn't be in this situation. That lady that had cancer, that died, she could have been saved if I would have been able to meet her and tell her, all you got to do is this. What got you there? Like, that you care like this?
There's too much greed in the world, and problems are solved very easily. They're not complex. And I see people from all walks of life just trying to make it. Just that little edge. So I research. I'm an engineer by trade, so problem solving is my gig.
You're a smart man, by the way.
So I don't know about that.
Yeah,
but
you're a smart man. I saw what you did, the degree. You taught at some universities. You managed some. You did some good stuff here.
But I see it as the largest population in the world right now is women. There's 8 billion people, 5 billion are women. With that kind of ratio, we're going to have more children. I mean, you just look at India, look at the US, look at places. The population boom is on. The problem is, there's no sense in having a population boom if all they're going to do is die.
Yeah.
So, of the 8 billion people in the world, less than 0.1% actually live comfortably. Most of the people live in abject poverty. So, in the US, if you look at state by state by state, you'll see that there's a lot of people that are underemployed and undermanaged in healthcare. The ACA plan allows them to get out of that. Okay. At least you can get to a doctor, which most of them haven't been to in eons.
Okay.
And the August 15th deadline, it might re-up, but right now, I'm trying to push everybody to get the word out, to get to anybody that offers healthcare, sign up for the ACA plan. You can do it online yourself.
Okay.
Go to aca.gov,
just sign up,
sign up, because it gives you coverage. And 9 times out of 10, you're going to get a big subsidy. I had 2 people that didn't have health care, and they got a $1,300 a month subsidy for both of them. Now they're covered.
Wow. That's awesome, man. I really appreciate you for sharing this.
Yeah.
So what's the most misunderstood thing about all of this in terms of what would keep someone from even this information? They found this, they listening to this, they're going like, oh my God, I need that. But they yet still won't take that action.
Fear.
How do we fix that?
We got to stop putting people into boxes. We got to reach out and help one person at a time. That the group help and all, we have 8 billion networking groups in this country. Everybody wants to connect with somebody. We got to stop worrying about just making money and worrying about helping those.
But I need money though, man.
True.
I got to take care of the babies and the babies. So how do I?
Right. But
how do I not lose in that process? Because I think a lot of people feel like they're going to lose.
Right. And what happens is there are other options. The days of just being in one field is over. Healthcare is going to be nationalized at some point. They just can't continue this program. So the question is, if I help you now and I work with you, I build that relationship, and I move into a different type of insurance, 9 times out of 10, you're going to be like, well, that guy took care of me, or that lady took care of me. There's that relationship. We got to stop looking at people as dollar signs and looking them as opportunities for the future.
I want to close with this question. When you think about elections and who's the president, whether it's Republican or whether it's Democrat, healthcare is always like one of the number one pieces of their campaign. Sitting through those campaigns, sometimes I think we still forget, like at the end of the day, I got to make sure I'm in a good situation.
Exactly.
If for some reason I get the call,
right,
hey, you did your checkup. Sorry to tell you, but you got something going on. That I don't end up in a situation where I leave a big old bill behind for my entire family.
Absolutely.
How in the world do we make sure we're putting ourselves in a position? How do we reevaluate our situation and say, okay, cool, I want to fix my healthcare situation right now.
Right.
What do I need to do? Because I still got that fear.
Right.
And I'm still confused, but I want to take this action now.
Right.
What's the process from that point?
Well, I would tell them to reach out to, and we have to stop just taking people for what they do. Just because a person sells cars doesn't mean he knows how to fix it.
Gotcha.
So just because somebody sells you something doesn't mean they know the ins and outs. You need to take control of your health and talk to the person that you're talking to and be like, here's my situation. How do I get to here where I don't have this humongous bill? And I'll tell you, the ACA plan, and private healthcare, because Medicaid is determined by the state. So that's a different one. But people that are on half Medicaid can supplement the other half with the ACA plan. So you got to know the metrics on how to tie things together. And that person you're talking to should be talking to you about plans and what plan works for you and your family, not here are the best ones for you, because who knows what's best for you.
Gotcha.
And people, the healthcare industry is not going to lose money. The agents aren't going to lose money because there are other things that happen. Even though you buy the ACA plan, you still have a deductible of $8,000.
Gotcha.
So there are programs out there that will take care of that $8,000 and turn it from $8,000 to $250.
I mean, it's really no excuse for us to leave our healthcare just hanging out there.
People do not let people know what's going on. So no one's...
And it's money. It boils down to money.
It does, because
if you don't know, then you still got to pay for certain things that I need you to pay for.
And I've known people that have called Medicaid and somebody sold them a healthcare plan on top of their Medicaid.
Wow. So they didn't even need that healthcare plan, but they still sold it to them. Wow. I don't even want to get into that because I'll get upset. I think about my grandmother's not with me, and I love her. I miss her, but I just imagine somebody did that to my grandmother, I'd be hot.
Yeah.
You know what I mean?
And people don't realize it because people don't understand what healthcare is, and they don't understand what their plan is.
Okay, I got the question now. Should people go to like healthcare conferences and go annually? So, I mean, would that be just as important as going to church on Sunday? Like going to the healthcare conferences where people are really trying to educate people on the plans they're getting on?
Absolutely.
Well, why don't we do that?
Because they're expensive. But what you can do is go online and it's like anything else. You don't just watch PBS, you know, and think the world revolves around that. You don't watch CNBC and think, you don't just watch Fox, or you got to watch the array. And then you have to discern, yeah, that information sounds right for me. This information, yeah, well, you know, they do that, so I'll take that from them. You have to be accountable for yourself to make healthcare work. And what a lot of people have done is they've outsourced that responsibility to the doctor, the pharmaceutical companies, everybody knows that one person that goes, oh my God, I coughed and my toe hurt, and then my other toe turned outward, and I have bronchitis of the leg. And it's like, no, you really don't. So it's not even the information, it's getting the correct information.
Oh man, trust me, man. One of the reasons we were motivated to start what we do, man. The conversation with the CEO and everything the Lynchpin Bunch does, that's the whole point. We're trying to help people grow.
Yeah.
You know, that's it. Man, listen, y'all just got through listening to Gregory Hodge. He is the managing director for Hemingway, Hodge and Associate. And you gave us some very great information on healthcare and insurance and just a whole understanding of that. Thank you for your time. Now, I want everybody to know this. He made sure to tell me he really doesn't want to do this. This is not an infomercial. He's not going, at the end, his number is going to show up because he doesn't even want you reaching out to him. He did this because he wanted to get you some information to get you going. Absolutely. And that's really what it was. I'm going to tell you something, man. You're going to be blessed for that.
I look at it, I've been blessed. I've been to 17 countries. I've lived there for a month at a time. I had a fabulous mom that can't be replaced. I've been blessed. And my attitude is we have to stop looking at people in pockets and realize we only have one species of us. And if we don't help each other, there's that poem. First they came for one group of people, I did nothing. They came for the second, I did nothing. Then they came for me and there was nobody there to help. It's a poem to live by.
Man, I got to close on that. I can't even say another word. Listen, if you're not growing, you're dying.
Yep.
See you for another episode.